A very important case study in psychology recently being done and performed at Jaslok Hospital, Delhi is a psychiatric surgery on an Australian patient. This was possible only after the changes in the 2017 Mental Health Act. The 1987 Mental Health Act did not provide the rights for a mentally ill patient to be recognized. However, the changes with the 2017 Act brought that right for the mentally ill patient to be recognized. And this is a lecture where we would be talking about a case study of depression and the deep brain stimulation surgery which was performed. So let's first talk about depression. Now, depression in simple terms is a mood disorder, but there are various important things that we need to understand about depression. 1 in 40 and 1 in 20 is the prevalence. So 1 in 40 is the past cases of depressions that have been cited in India, and 1 in 20 is the current cases of depression that are cited. It is believed that 15% of the population is affected by depression, 14% in the high income group, and 11% in the low income group. And that means the proportion of the people facing depression at some point in their life, past or current, has been significantly high. Now, with this depression, there is a treatment resistant depression. This treatment resistant depression says that these people with depression are not responding to medicines, they are not responding to psychotherapies, they are also not responding to any kind of ECT therapy. So in this case, what is a alternate option which has been discovered recently and performed recently at Jaslok Hospital is the deep brain stimulation surgery. Now, what is deep brain stimulation surgery? Now, when you want to stimulate the brain, what is done? There are two holes which are put in the skull and through which an electrode is placed in the brain. Now, this electrode actually nullifies the abnormal impulse which are generated in the body. Now, with this nullification of the abnormal signals that are there, there is a pacemaker which is installed in the chest, and behind the skin there is an extension of nerve fibers or the network which is connected to this pacemaker, and this neurostimulator actually stimulates the brain with positive vibes. Now, this is a mechanism which was recently performed in the surgery, and this is called as DBS, a very important case study to treat patients of depression as per the recent studies. Now, so far this is already a recognized technique. This is not a new technique. It has been used for treating Parkinson's, it is used for treating obsessive compulsive disorders, for epilepsy, and also for various Dysnic diseases. However, this is for the first time that DBS has been used to treat a patient with the acute case of depression. The patient had reported the case of depression since last 26 years, and with such a long prolonged history, oneself being part of the healthcare system, this surgery was performed on the consent, and this, if proved successful, could open new windows and new avenues under psychiatric surgeries, and specifically under the treatment of mental disorders like depression. With the enactment of the Mental Health Act 2017, the process through which these things could be performed have been more streamlined, and not only this, it also protects the right of a person who is mentally ill and facilitate the treatment by advancing the directives that could be laid down for the process of treatment. So those are some of the key things that you must be familiar with. Now, as I mentioned before, this is an extremely important case study for psychology optional. The complete lecture course for your psychology optional is available in the link below. Thanks for joining in today. If you have questions, feel free to connect back. Thanks a lot.